To the Filter Wire EZ Embolic Protection System Carotid Artery Stenting Training. Please refer to the Filter Wire EZ Embolic Protection System DFU for complete directions for use. The Filter Wire EZ Embolic Protection System is indicated for use as a guide wire and embolic protection system to contain and remove embolic material while performing angioplasty and stenting procedures in coronary saphenous vein bypass grafts and carotid arteries. Pre-Procedural Pharmacology Review. Standard patient preparation commonly used in angioplasty is recommended when using the Filter Wire EZ system. An activated clotting time, ACT, greater than or equal to 275 seconds should be maintained. Angiographic Considerations. Before beginning the procedure, identify the optimal landing zone in the vessel for the filter using the following criteria. Deploy the filter as distal as possible to the lesion. At a minimum, the apex of the filter loop should be deployed at least 3 centimeters from the distal edge of the target lesion. The Filter Wire EZ system should be placed in a vessel segment between 3.5 millimeters and 5.5 millimeters in diameter. Product preparation. The Filter Wire EZ system is comprised of 1 protection wire with incorporated filtration system, 1 peel-away EZ delivery sheath, 1 EZ soft-tip retrieval sheath, 1 accessory kit containing 1 peel-away introducer sheath, 1 wire torquer, and 1 valve dilator. The preloaded protection wire and EZ retrieval sheath come packaged in 2 attached protective coils. Note that the EZ delivery sheath is indicated by a black handle, and the EZ retrieval sheath is indicated by a white handle. Begin product preparation by unclipping and removing the yellow protective housing from the filter. Disengage the preloaded protection wire from the rubber retaining clip and advance the delivery sheath until the clear section is exposed. Grasp the clear section of the delivery sheath and completely remove the preloaded protection wire from the packaging coil. Advance the provided wire torquer onto the wire and tighten close to the exit port. Grasp the very distal end of the clear section of the delivery sheath and submerge the filter in heparinized saline. While immersed, pull back on the wire and gently draw the nose cone into the delivery sheath until resistance is felt. The nose cone is designed to enter the distal tip of the delivery sheath 1 to 2 millimeters. The device is now ready for the intervention. Device insertion and advancement. Carefully insert the tip of the sheathed protection wire into the peel-away introducer. Then insert and advance the entire assembly into the hemostasis valve attached to a guide catheter or guide sheath. The minimum inner diameter of the guide catheter or guide sheath must be 0.066 inches. Once the device has been advanced into the guide, peel away and remove the introducer. When advancing the device through the guide catheter or guide sheath, advance both the protection wire and the EZ delivery sheath together. When navigating the vasculature, use a 2-handed technique, advancing the delivery sheath with one hand and torquing the wire with the other. To prevent inadvertent filter deployment, do not push the wire as you are torquing it. If the lesion is difficult to cross, consider using a buddy wire technique. Pre-dilatation with a small balloon catheter can be used as necessary. Filter positioning and deployment. Use device markers to confirm device position in the predetermined landing zone. Secure the wire in place by advancing the torquer to the hemostasis valve. Tighten the torquer firmly on the wire. To deploy the filter, stabilize the wire by pressing the wire torquer against the hemostasis valve, and then pull back on the EZ delivery sheath until the filter loop is deployed. Continue peeling away the delivery sheath until the clear rapid exchange section at the distal end appears. Remove the wire torquer and then remove the remaining distal segment of the delivery sheath. Once the filter has been deployed and the delivery sheath completely removed, inject contrast to verify the filter is patent and in the proper position. If repositioning is necessary, use the easy retrieval sheath to recapture and redeploy the filter. During the procedure. To avoid excessive movement of the filter during the procedure, stabilize the protection wire when exchanging devices or when repositioning the guide catheter or guide sheath. Check flow frequently during the procedure. If there is slow flow, consider removing the device and replacing it with a new one. If at any time during the procedure there is no flow, immediately remove the filter wire EZ system with the easy retrieval sheath and replace it with a new device if further intervention is required. Filter capture and retrieval. For filter retrieval, use the easy retrieval sheath indicated by a white handle. After removing the sheath from the packaging coil, flush it with heparinized saline, being careful not to damage the tip with a syringe. Backload the retrieval sheath and advance over the protection wire until the tip of the retrieval sheath reaches the catheter stop, just proximal to the filter loop. If it is difficult to advance the easy retrieval sheath through the deployed stent, try the easy bent tip retrieval sheath. Secure the retrieval sheath and pull the protection wire proximally until resistance is felt. Under fluoroscopy, check to ensure the distal edge of the collapsed filter loop is even with or proximal to the retrieval sheath marker band. After successfully capturing the filter, retract and remove the sheath and protection wire slowly as one unit. If a fixed hemostasis valve is used, the valve dilator tool is required to facilitate removal of the filter wire EZ system. Place the valve dilator on the shaft of the retrieval sheath and slide it into the valve. Remove the sheath and protection wire from the patient through the valve dilator and then remove the dilator. Thank you for using the Filter Wire EZ Embolic Protection System. Please contact your local Boston Scientific sales representative for more information.